In our first interview with Dr. Jonathan Vitale, we talked about cardiovascular health. Now he joins us once again. We're going to talk this time about some weightier matters of the heart, love, loss, and all the rest in between. Dr. Jonathan, first things first, we got to figure out what are your credentials in this love field. We know you're a doctor, all right, but I think a lot of our viewers are kind of curious to know where you're coming from before hearing your perspective.
Okay. Well, in addition to being a family physician and an osteopathic family physician, actually, I'm also a national certified counselor. So I'm a therapist as well, and so I have a lot of experience not only in counseling patients, but also in relationships too.
All right, that'll help, I think, here, and then we can move forward. Now, there's a little bit of a medical element in play. Relationships are a lot of times a very human experience, a lot of heartbreak, a lot of love. There's like a positive experience as well. But how can this really affect and impact the body? What's happening beneath the surface?
You know, what's interesting, Mark, is this really all comes down to stress in terms of relationships. You have to realize that the mind and body are not a dichotomy. They're connected in ways that we do not even understand. So really anything that you experience in your psyche or psychologically is going to manifest itself in some way in your body. And this happens all the time with stress, right? Which happens with people in relationships when they don't have healthy relationships and they have a lot of stress. Oftentimes what happens to your body is your blood pressure goes up, right? It starts interfering with your sleep. It starts making you feel not as healthy. So especially in America, stress is a very big problem and actually a component to heart disease. It can get that bad. So it's important for people to realize that, especially in their relationships, they need to have healthy relationships with not only their loved ones and their spouses and their family, but also with the people that they work with and with their friends. So it's important to always try to have very healthy relationships in your life to keep your stress levels down. And also, people just enjoy and need to be affiliated. We need to feel a part of something. And having good relationships is an ideal way to do that.
Certainly good advice. And I think one thing that's true in medicine, and also maybe in life and in relationships as well, there's sort of a preventative maintenance, and then there's disaster recovery. Let's back up a little bit. Somebody who's maybe looking at the prospect of marriage, love, a stressful relationship like that, what are some things a person like that can do to prepare and look out for those pitfalls that could have stress or spell stress for them down the road?
Sure. You know, marriage is a wonderful thing, and it's so important to make sure that you're marrying the right person. There's a lot of steps that you can take. My biggest piece of advice for people who are looking to get married is to know that person for at least a year and a half. That's how long you have to know somebody in order to really know them, to see how they react to stress, to the ups and downs in life. So really you have to know that person to know that they're a match for you. The other thing that you want to realize is that you have to tell and know, is this somebody who can resolve conflict with me in a humane way? Do we get along? Because you're always going to have conflict in any relationship. And it's important to know that the person that you're entering into marriage with or any long union is somebody who can solve a problem with you together. Because it's in a marriage, what's not important is how often you fight. That doesn't matter as much as what happens when you fight. Okay. So that is really important. So you got to know the person well, and you got to know if you two get along.
And very interesting. So doctor's orders are in. You have to take 18 months to know the person, and that's the prescription.
That's right.
That's interesting. I've also heard another scenario, or I suppose an analogy, and I'd like to know your thoughts on this. I've heard it before that people can be like chemicals, and we've heard of that chemistry thing before. Two people coming together, they can independently be very positive energy people, but together maybe there's a clash. Do you find any kind of, does that resonate with you? Do you feel that chemistry thing is a real element in a relationship?
Yes, I do think that there is a certain chemistry component to relationships that we don't really even understand. But what is important to point out is you can take two people who are really good people, positive people on their own, but once you put them together, they kind of almost turn into monsters. It is, and we see this all the time in marriage counseling. Some people just are not good matches for one another, and they would have known that if they had known each other for a year and a half before they decided to get married in most cases. So you have to realize that, some people just are not good matches, and we don't really understand why, but that is that chemistry that we talk about.
And then after that comes it's not you, it's me conversation, right. And then there's the stress and the breakup, and it's all a vicious cycle.
That's right. Yes.
It's craziness. But of course, we know love can also add or eliminate stress, but there's also a lot of other factors too that can pile on to the stress factor here. Like, for instance, finances.
Sure.
They all play in sometimes when it comes to marriages.
Absolutely. What's interesting is I was just reading some research at the millennial generation, which is a very large generation right now, are the most stressed generation ever. And they're most stressed about one thing, money. And it's also interesting that if you look at marriages and what breaks them up, one of the main things that breaks up marriages is arguments over money. I often joke that the vows should be changed to not for richer or for poorer, but for poor and for poorer, because nobody ever gets divorced because they both become too rich. So it's important to understand that money is not everything, and it's important to make sure that you understand that it's a tool. It only serves as a tool to help you in your partner's life goals, and to make sure that this person who you're considering marrying has the same life goals as you do. If you want to have children, if you want to travel a lot, if you want to have all those things, and make sure that before you get married that you sit down with a financial counselor and that you go over how you're going to make that work with both of your finances.
It's a fresh perspective, but of course, to have money, unless you win the lottery, you really have to go to work. And that's another place that a lot of people find added stress. You ask people, where do you get the most stress in your life? A lot of them would point to work. Of course, neither you or I experienced that, but
definitely not.
Let me ask you, how does a person concentrate on performing well at work and sort of put the stress off? Is it just a matter of mental approach?
It is. It can be a variety of things. A lot of it is your interactions with your colleagues. And this can be definitely just the fact that you work in a cubicle surrounded by people all day, which may really stress you out when you hear all of their stresses. And another thing that's very common now is we're always connected. You're always reading your email. You're always checking your phone especially when you're at work, and this stresses you out even more. We have constant interruptions, whether it's by technology or by colleagues, which stress us out even more. So this is why I really encourage people at work to try to figure out what their zone is and try to figure out how they can sneak away and kind of just be alone for a while to get work done. It's also why it's so popular now to telecommute. Many folks have at least part of their job they can do remotely. And this helps a lot of people to concentrate and reduce their stress, especially people who have other obligations like family that they need to take care of, which causes a tremendous amount of stress on any relationship. Being home more often helps that.
A little bit of preparation, a little bit of thinking can go a long way. One other thing that's been causing a lot of stress for a lot of parents in particular lately, it's been in the news real quick. I want to get your take on this before we let you go.
Sure.
Vaccines, in particular, how they relate to measles. We're showing one of your tweets recently calling out Dr. Jack Wolfson. He's been outspoken for his anti-vaccine stance. Would you care to expand on any of those comments you made on Twitter real quick?
Sure. What I'll say quickly is that vaccines are one of the biggest successes in public health that America has ever had. Vaccines are proven to work, to be safe, to be effective. We really need to be vaccinating all of our children appropriately in this country. And any medical professional who says otherwise really doesn't know what they're talking about.
Is there any? There is an alternative mindset out there, though, that has grown rather rampant in the last few years. For instance, USA Today report said earlier in the year when school was just starting, greater than 50% of parents at least raised a question or a concern to their family practitioner before taking the vaccination. Does that speak to something about raising a sense of question about whether the public health officials just all say one message? Should there be any questions asked, the hard questions maybe?
I always encourage parents to ask questions, and they should. And you should be asking questions to your doctors about these vaccines because that opens up the discussion so you can understand why why they work and why they're important. So we're in a society where people are smarter. They listen to especially the lay media that now talks about vaccines and public health issues more frequently. So I think it's good that people are raising these questions. Fortunately, whenever parents ask me about this, they're just genuinely curious. I have never had a parent who I explained everything to and they said, well, I don't want to vaccinate myself or my child. So I think it's always good for patients to be informed. Ask your doctor if you have any question, but at the end of the day, getting vaccinated just makes sense. And the patients realize that after they get informed about it.
All right, great to have you with us, Dr. Jonathan. Thanks again.
Thank you so much, Mark.
All right, up next, we move on later in the broadcast, Out of Bounds. We'll be right back on WHDT.